My name is Shirley Mary Johansson. I'm 90 years of age and I live in TAVI. I'm married, been married 69 years to Ron Johansson. He never turns lights off.
It's deliberate. It keeps her active. Oh, she's a good woman.
Oh dear. It was a gradual thing. It came on slowly. I realised a couple of years before I did something about it that I was getting very breathless.
Aortic stenosis is a common heart valve problem affecting adults. It's one of the most common life-threatening heart valve problems. As we get older, if you imagine like an old door that has difficulty opening, in many elderly people, the aortic valve has difficulty opening properly. In some people, this difficulty opening is so severe that the heart is essentially trying to pump blood out against a pinhole.
I just ignored it, and then it got to the stage I got out of the bus, which is about 5 houses down the end of the street, and by the time I got here, I would have to stop about 3 times to get my breath back.
The symptoms that you classically get are shortness of breath when you walk or when you exert yourself, chest discomfort, or lightheadedness and fainting.
But of course it gradually got worse, and by the time I finally went, I knew I had some sort of a problem.
And this limits their quality of life. They're restricted in what they can do. And its worst is like slowly drowning as their lungs fill up with water because the heart won't pump the blood around fast enough. And in the elderly people, they're noticing their legs start to swell up with fluid. They're struggling to breathe and just get around the house and do their usual activities.
Once you have any of these classic symptoms of aortic stenosis, you have a high rate of dying or not surviving over a period of 1 to 3 years without correction of the aortic stenosis.
So if it's critical aortic stenosis, then they have a significant 30 to 40% chance of not surviving 6 months.
To be frank, her aortic valve was critically narrowed. It was really like the most narrow pinhole you could imagine. The heart was really struggling to get blood out. I was very concerned for Shirley. I actually said to her the first time I met her that, look, you seem well now, but in this situation, you have a time bomb.
I should have gone earlier.
For an elderly patient, particularly an elderly person who had multiple other medical issues, often there was no treatment for aortic stenosis. In other words, no way of fixing this aortic valve narrowing definitively, because surgery posed too high a risk for that patient.
Because of my age, I was too old for the usual operation. I was told that there wasn't a thing they could do, so I didn't have a very good future to look forward to.
I was very concerned.
This condition is associated with the risk of sudden death. So unfortunately, many of the patients who have this condition, they pass away suddenly and unexpectedly as well.
Well, she had nowhere to go. That's what it amounted to.
The procedure that's called TAVI, it stands for transcatheter aortic valve implantation. It is one of the most revolutionary procedures in all medicine that has come about in the last decade or so. It essentially involves the implanting of a completely new heart valve for somebody without having to open their chest. That is revolutionary.
We access the artery in the groin and use that as a portal of entry to put a tube up the inside of the artery all the way around into the heart, and then compress down on a metal stent wire mesh, a tissue valve that has been internally sewn into the mesh, and place it inside the heart. And for the sapien valve, we then deploy it by pacing the heart so that the heart stops ejecting blood, so that the valve doesn't move within the heart. We then inflate or blow up a balloon inside the mesh or stent which then secures it inside the existing aortic valve.
Once the valve is in place, the valve is a replica of a human aortic valve. It has 3 leaflets. And once this valve is properly expanded, it just starts to function right there and then, immediately. From the first beat, it is exposed to blood. The recovery is often totally remarkable and a complete contrast to open heart surgery.
And many of the patients don't even go to intensive care. They go to coronary care, where we have monitoring rather than ventilation, and we can keep an eye on the patient to make sure that everything's stable, they're not ignored, but they don't require the same intensive ICU, ventilation, high technology support and monitoring.
I was in hospital for about 4.5 to 5 days.
She was awake a few hours after the procedure and walking the next day.
And evidently I came through okay.
Do not fail to be surprised by how somebody like that can have a major structure put in their heart and then be walking and independent the following day.
And a very short convalescent. There was hardly any... I came home and life went on much the same.
And being able to come in and see somebody who's awake 2 hours after an implant and see that they've got minimal drains, they're looking pink, they're breathing and they're comfortable is a massive shift in the actual immediate impact of the surgery. And then the procedure thereafter, where they're able to interact and take their loved ones' homes and participate in their hospital discharge at an earlier date and see them getting back to normal activities early. It's a fantastic thing for the families.
We have had frail 91-year-old ladies leave this hospital and go shopping in the major shopping centre across the road for a full day on the day they are discharged. We've had a gentleman play 18 holes of golf 5 days after the TAVI without use of a cart on the golf course. We are shocked by these stories from our patients, but you know, it's a tribute to the procedure and the technology. It is now the treatment of choice. We feel that the product, it is the archetypal and iconic product in this field, but I am optimistic that one day, you know, even for a late middle-aged gentleman who has aortic stenosis, perhaps they will just come into a hospital, have a valve in and go home the next day. A revolutionary thing. It would not only be much safer for that gentleman potentially, but it would save a lot in hospital costs. So there's a huge benefit, not just for the patient, but for society.
We have had an active sort of life. I used to have the 2 girls come in and do the housework once a fortnight, but I've cut them back to once a month. And I feel I have a lot more energy.
You want to maximise that time so that it's good quality time, and keeping people independent, able to live at home, not in a nursing home, not having oxygen wheeled around with them when they try and walk around the floor. That's a huge clinical benefit to people. So it is a paradigm shift in medical treatment. It does have proven survival benefit and makes people's quality of life vastly superior.
She is able to do all her activities without shortness of breath. She is a very vivacious and sociable and delightful elderly woman who lives life at its fullest, perhaps fuller than many of us who are younger. The Edwards Sapien valve has, you know, given her back her life. She's now able to do everything without shortness of breath or symptoms. And I think that she will live an even longer and happy life as a result.
It really is a fantastic time to be in cardiothoracic surgery now, because we have the capacity to treat people we just wouldn't have looked at 10 years ago.
TAVI saves lives. Having a TAVI reduces your risk of dying by 45% at 1 year. I mean, that is, in absolute terms, the largest reduction in mortality that I know any cardiovascular device has been associated with in my lifetime.
I think we struggle to keep up with each other these days.